Thank you very much. On behalf of the government and people of the Gambia, we want to thank the organizers. Now, the Gambia, as you know, is about 1.8 million, with a backlot of 86,000. Survival infant mortality rate is about 34 per thousand. And the hepatitis B coverage is 98% at birth, and then Penta 3 coverage is 96%. As part of our routine services, hepatitis B vaccination scheduled in the Gambia is given in 4 dose series, as it has shown. Our discussion is going to focus on the Gambia Hepatitis Intervention Survey, which was aimed at prevention of primary liver cancer through HPV vaccination at infancy. This is a collaborative study between the Medical Research Council, AG, WHO, and was launched in 1986. It was launched in, the objective was to evaluate the effectiveness of hepatitis B vaccination in childhood for the prevention of HPV infection, chronic liver disease, and hepatocellular carcinoma in the adult population at high risk. It came in 3 different phases. Phase 1, that was between 1986 and 1990. The Hep B vaccine phased into the EPI over a 4-year period. That's our expanded program of immunization from July 1986 to February 1990. Since February 1990, the Hep B vaccine has been offered to all newborns as part of the EPI schedule in the Gambia free. Phase 2 shows the efficacy, which was 1991 to 1997, where we did a short-term evaluation, and the efficacy of hepatitis B vaccine against infection and chronic cardiac estimated through longitudinal and cross-sectional surveys in selected groups of hepatitis B vaccinated and unvaccinated children. Phase 3, that was it was initiated in 1998. It consists of long-term follow-up through cancer registration using HCC as the primary endpoint. I will emphasize on that later. This is how we designed the program, because we have over 95% immunization coverage, so we're trying to link it with the API system. So we made a stepwise design for introducing the Hep B into the API system. In the Gambia, we know that the most common cause of cancer is liver cancer, which accounts for 57.3% in men, and in women, it's the second cause, 20.3%. But when we look at that was give us a background. In phase 2, when we look at the efficacy against infection and chronic cardiac, after 4 years, after introducing after 4 years, we realized that we still have 84% against infection, and against chronic cardiac, it was still 94%. So after 9 years, it still remained the same. There was not much changes. That showed the efficacy of the vaccine we are using. In phase 3, we initially estimated to last for slightly over 35 years on the basis of several assumptions, making reference to cancer research documents, includes core components, nationwide cancer registration. And the beauty of this is that from 1986 to date, we are keeping a cancer register. There's an active surveillance for cases of HCC and cirrhosis and other types of liver disease, and the extensive efforts to determine if cases belong to the GISO. So whether a complete population enumeration, sample surveys, or a case control approach is to be adopted, it now needs to be carefully reviewed by all stakeholders in the Gambia. And this is something we also want to sell in the sub-region. What we did is we did a cross-sectional survey. 40 villages were selected. All children born from 1990 were vaccinated. Blood samples taken from carriers and carriers' mothers for further serology studies. And then this is what the result. It shows that at least we have a prevalence of 0.41% in all the cases, which is still very good indication. The survey showed a decline over time in the positivity in significant and encouraging. The parental transmission does not appear to be important, unlike elsewhere in Asia. Then we asked ourselves, and this is what I used to convince the Minister of Finance to put more money in the health budget. It's the Gambia API eradicating HPV-free. So this is what it shows. Before the mass campaign, at least this is the percentage. This was before the vaccination, at least 90% and 10% respectively. But after the vaccination, when we did the evaluation, so this is the result we saw, which is very convincing. Now, the global impact. Tremendous improvement of the Gambia API with more than 90% coverage for Hep B and oral polio vaccines. Improvement of the country clinical diagnosis capacity, because this has even paved the way, has helped also change policy and bring in more means of dealing with issues. And we are trying to challenge this for a model for Africa, non-African countries, for the introduction of new vaccines. There's an opportunity and support for research projects on etiology in collaboration with Prolifica, project on investigation on treatment and modalities against chronic hepatitis. And there's a new potential in new relationships. That's the impact the GIS. At the level of the African Union, there's a partnership for aflatoxin control in Africa study. And they're based on research also on this thing. So I thank you very much.